So we'll be starting. Welcome everyone to the fifth webinar organized by the Governance Ethics Conflict of Interest Network. This is our second webinar series. All our webinars are recorded and posted on our website. Although we have webinar participants who know about the network, I will be sharing, once the presentation starts, a document that gives more information about our network. The title of the webinar today is the Public Health Playbook, Ideas for Challenging the Corporate Playbook. I would like to welcome our two presenters today, colleagues and longtime members of the Governance, Ethics, and Conflict of Interest Network in Public Health. Hi, Eric, and hi, Jen. Great to have you present today for us on this webinar series. My name is Rima Nakash. For those of you who I haven't met, I am at George Mason University at the Global and Community Health Department at the College of Public Health in the US. I coordinate this global network with my colleague, Dr. Mel Mayon, who is from Trinity Business School, Trinity College in Dublin, Ireland. The webinar will be a 1-hour presentation. We will go over our presenters' proposed public health playbook, sharing ideas and strategies for how the so-called playbook can be anticipated, countered, and prevented. We will have around 40 minutes for presentation and leave some time for questions. I invite you to share questions via the chat box, and then during the time for questions, of course, we can take questions directly from you by unmuting yourselves and through Zoom. I would like to introduce our speakers today and then leave them off to start. Our first speaker is Dr. Jen Lacy-Nichols. She's a research fellow working with Victorian Health Promotion Foundation on the commercial determinants of health. Jen's research explores relationships between corporations, politics, and health, and is motivated by a concern that a small number of powerful commercial determinants, actors, and individuals control a disproportionate amount of the world's resources, and their activities often drive poor health and health inequities. Her current program of work focuses on the development of strategies to systematically monitor commercial political practices and draws on tools and theories from political science, public health, business studies, and data science. Dr. Lacy-Nichols has a doctorate at the University of Melbourne. She completed in 2019 that analyzed the soft drinks industry's political strategy to position itself as part of the solution to obesity. Her subsequent research has continued to explore the theme of corporate co-optation and the risks and limitations of corporate harm minimization strategies and efforts to involve business actors in public health governance. Our second speaker is Dr. Eric Crosbie. Dr. Crosbie is a political scientist who examines commercial determinants of health and public health policy. His research focuses on NCDs and examines how commercial industries such as tobacco, food, beverage, alcohol, fossil fuel, or pharmaceuticals are key drivers of the NCD epidemic and how they influence public health regulations. Dr. Crosbie's research is local in analyzing smoke-free environments and sugar-sweetened beverage taxation regulations in the US, as well as globally in examining tobacco and nutrition packaging and labeling practices on the impact of trade on health. Dr. Crosbie has both local and international expertise, collaborating with health organizations and advocates to educate and disseminate academic research findings to policymakers, including, of course, publishing research in Spanish to reach wider audiences. Dr. Crosbie also works with undergrad and grad students to publish and present research. Overall, his research is multidisciplinary, combining elements of public health, political science, international relations, economics, law, and business to examine public health policy both locally and globally. I'm very happy to have both colleagues presenting today in our webinar. And Dr. Lacy-Nichols, I'm going to leave the screen for you to share, and I believe you're able to share your presentation.
We hopefully should be all good. Thanks, I suppose, on behalf of me and Eric for the incredibly gracious introduction. I'm always reminded how long it is. And sometimes I envision 40 years down the track, just chopping and editing and all of that. So Eric and I, we've designed what we're hoping is an interactive one. We've got one slide deck. We're going to flip-flop back and forth that. So any technical errors and awkwardness is all on me. I'll take that. So we're talking today about the Public Health Playbook, which is a paper that we also wrote with Robert Martin and Rob Moody last year. And I think it took us a couple of years of sort of talking about this and thinking about it. One of the joys of an international weird time zone collaboration that have become more frequent. But this, in some ways, I think part of the inception came out of a paper Robert Martin and I actually did a couple of years ago. Here's my little sort of genesis story at the beginning, where we said, let's talk about power, let's talk about commercial determinants. We'll do this quick and dirty paper. This will be really fun. And we always sort of said it's really easy to talk about the problem of commercial determinants of health. It's much, much harder sometimes to talk about what we do about the commercial determinants of health, because it comes down sometimes to capitalism. And that's a big structural challenging thing, and it's sometimes called the C word. So it's an intimidating thing. So we thought, why don't we see what we can do about coming up with some things that the public health community specifically and the actors in the public health sector could try to do in this space. So this is where we've gotten to, and I suppose the other thing that I think was interesting on this paper is that it was one of those papers where the peer review process was just fantastic, because they raised really, really tricky questions. A lot of it was around, well, we want more evidence, we want more rigor. And we said, we're so sorry, it's a comment, we get like 20 references, there's nothing we can do about that. But in some ways, the whole peer review comment and process has raised a whole other set of interesting questions in future projects, which I think is one of those hopeful, the best possible things. So that's my sort of bit. And there we go, wouldn't change places. I also want to say that today I am presenting from the lands of the Wurundjeri people of the Kulin Nation here in Narm, Melbourne, Australia. And I'd like to pay my respects to elders past, present, and emerging. Sovereignty in Australia, like most everywhere else in the world, was never ceded. I am on stolen lands. And it is, especially as we're talking about commercial determinants and neo-colonization, which comes into this, incredibly important to remember the strong and enduring ties that many communities and peoples around the world have with their land and the knowledge that we gain from that. So, Eric, I believe I'll hand this one to you, and then we'll go back and forth.
So, thank you everybody for being here. So warm welcome, and thank you, Rima, for the introduction. So we haven't really planned this. We're just gonna kind of go back and forth and present slides together. And the hope is, as Jen mentioned, was to have let us tell you a little bit about this corporate playbook and then the public health playbook, and then have more of a discussion. So we want to save more time for that. So just first off, just to point out, those of you who are interested in commercial determinants of health, to point out that when we talk about corporate playbook or the corporate practices, we all recognize that there are good things from business, but we are really focused on what we call health harming industries. So, big corporations, transnational industries that have big market shares, whether this is the traditional corporates like tobacco and alcohol and food and beverage, but also pharmaceutical, fossil fuel, now gaming, baby formula, anything that's harmful to your health, right? Practices, whether it's marketing, lobbying. And so we identified 8 major strategies from the corporate playbook, from things from, framing and reframing discussions and debates, different corporate activity around regulations of basically trying to avoid regulations because that's going to hurt their profits, direct influencing, lobbying right into the political process, and then just developing alternatives, more self-regulating, weaker regulations, things that are going to allow them to continue to sell those products. And so you can see the outline here, but we'll move on now to the next slide.
So to Eric's point that when we talk about commercial determinants, we've often historically focused on a fairly small segment of the commercial world, often linked with the non-communicable diseases and the WHO best buys in that space. We thought it'd be useful to point out some of the whole point of the corporate playbook is that it obviously straddles all industry sectors. And so the Donald Duck litter bug is one of my favorite examples that came out of my thesis, actually. For those in the United States, we've got the Keep America Beautiful program. In Australia, we've got Keep Australia Beautiful. My guess is there's probably other sort of iterations around the world. And this was one of the first examples of that sort of corporate social responsibility. We're being blamed for something because our branded products are being seen on the road. The tobacco industry also helped out in Australia to fund this. And it was one of the first sort of initiatives to say, let's blame the consumer. They invented the term litter bug. That was an industry brand invented term. And they encouraged everyone to sort of do their part and pick up all the literature, the litter that had fallen on the ground. And it's just that early iteration of both we can be part of the solution, we need to get on the front foot. This was the plastics and the soft drinks and the tobacco industry, circa the sort of 1950s environmental movement. But it's been enduringly successful. It still exists today. So I think that just speaks volumes for just how successful some of these strategies can be. And the other one was just looking at Google's revolving door, and the sort of points I think also, and we'll come back to this, the amazing work that other sectors are doing. So this is researchers and data scientists in the tech space saying, hold on, Google has an insane sort of political access both in the EU and the United States. But those are just sort of two very quick examples of that corporate playbook, which is what we want to challenge.
Okay, great. So as Jen mentioned, I mean, if you look at a lot of the literature in commercial determinants, a lot is focused on the problem, which is rightfully so. We need to start by understanding, what the problem exists. But what this paper set out to do was to really look at, okay, what are the solutions, or what can us in public health do to try to counter, or in many ways try to proactively, and you'll hear me say this a lot, Jen's probably tired of me saying this, but proactively try to address these issues. So we have these 8 strategies, so to speak, that are part of the playbook, and in no particular order, or one's more significant than others. We're just going to explain each of these in quick details. The link is below to the citation if anyone wants to read further, and we'll have a deeper dive into a couple of these areas. But just to point out each of these, public playbook, strategies. So the first one here is really about increasing public sector resources. And this is really first, when you're understanding the problem, these are big transnational corporations that have a lot of resources. And so they have an arsenal of some of the best lawyers, economists, political scientists. And they can lobby, and they can spend a lot of money in marketing. And so one way to combat that is you have to have some kind of resources financially, but also, technical and, legal expertise as well. And so this is first by understanding that, that you need more resources to combat that. So there are different ways to try to, gather some of those resources. Some of that is from, some of the examples here about, policies that are put forward. So if you're putting a tax on sugary drinks, how do you collect some of those funds and earmark them, or, position them so that they're actually reinvested into the community, to either promote equity and healthy eating and things of nutrition, education, things of that sense, or other areas that can really combat that. So, finding more of those resources. And that's really important, especially when we look at low and middle income countries and countries that have even lower resources. So, how do you connect with, and this kind of extends to the second point here, which is how do you expand both public health training, but also those coalitions? So how do you link up with private donors and World Health Organizations and other advocacy groups that you try to fight on a common purpose or a common threshold? And so part of the second part of the playbook is really understanding that if we are in public health, for most of us, like myself, I come from political science, looking at it from that lens, but also thinking about journalists and lawyers and economists. Again, going back to, we need to have our own kind of team. This is a big fight, an arsenal of some of the best leaders in these areas, but connecting them in a way that shares a common goal, a common message. So for us, it's public health, but understanding that there are health implications, health in all policies. So what is the impact on the environment, human rights, social justice. And so connecting those points to really, train individuals, but also have coalitions and networks. Sorry, there's a lot I can say, but we'll just leave it at that. Yeah. Okay, next slide. Yeah.
All right. So I guess really to an extent, following on from that second strategy of, I guess if we think of the second strategy as that internal capacity building within the public health sector, there's also the point to say that, to an extent, when there's a capacity limit around that, we can't just have capacity in everything. And there's so many other fantastic organizations that have been doing this work for so very long that it's very worthwhile to connect with. So a lot of the there's in the food space, which is where I sort of cut my teeth in this area, we've got La Via Campesina, and there's a range of sort of organizations. The ETC group in the EU does amazing research looking at some of those questions of technology and power and sort of corporate control in the food system. And a lot of these organizations have huge civil society networks and organizations around the world. And I think in some ways that's perhaps where public health has struggled a little bit. Public health does come a little bit more from that medical background. And we'll say, like Eric, I'm an outsider to public health. So this is sort of what I see coming into it. I guess for those who come very much from the public health sector in our audience, I'm very interested to get your take on this as well. But I do have this sense sometimes that public health has always been a little bit more formal and a little bit more medical sometimes than other sectors. And that is a strength in some ways, especially when we think about the sort of legitimacy power that doctors and that label and others have, but there's also all kinds of limitations that come with that as well. So these were some of the social movements here. And I guess the other thing I was thinking of is I'm reflecting on this right now in Australia, because like many countries around the world, we're just not sufficiently democratic. We don't have very good transparency in terms of lobbying and political donations. And I'll come back to that later because that's my deep dive. But it's been really interesting to just have conversations, especially with a lot of the organizations pushing for democracy, pushing for transparency, pushing for anti-corruption around the world, because so much of that is really around challenging the fact that we have gross power imbalances within the political system, and having better transparency and having better sort of rules and regulations around how and which corporations and which actors might be able to access governments and what citizens deserve to know about that, I would say fundamentally very much aligns with a lot of this sort of commercial determinants of health stuff. So I think there's some really interesting opportunities around the world to sort of link with some of those other groups. So there's the social movement sector, there's ones that work on food, you'd have access to medicine, right? That's a health medical issue, but it's fundamentally about challenging power. So there's all these sort of organizations that have sort of worked with that question of corporations have power and it's too much and we want to do something about it. And those are sort of just natural sort of entry points, I think. The other part of that, I guess, when we think of strategy 4 is that once you start pushing quite hard against some of these actors, it can backfire. And certainly those who work in the tobacco space would have lots of experience of threats and defamation and all of that. I have colleagues and friends who have worked in the alcohol sector and, the fossil fuel lobby. I don't have personal friends with that experience, but I have read that. And I know I was talking to Eric, and he's, there's colleagues in Central and South America. There's a whole expose around sort of the hacking and the threats that go on. And I think, speaking as an early career researcher, one of the things that's sort of going on I raised my hand somehow. Speaking as an early career researcher, there's a lot of vulnerability and job insecurity. And I think this is the case for a lot of sectors around the world. And so in the same way, we've seen the decline of union movements in sectors all around the world. And we've seen a decline of some of those worker protections. I think there's a lot of vulnerability in the space, both as researchers, but also sort of other sectors. And it's important to have protection measures in place, whether that is from your employer, if that's the university sector. This here is an Australian example, again, of the McCabe Centre for Law and Cancer. And that's essentially set up to help protect people from tobacco industry sort of personal litigation. But it's just, I think perhaps this is one of the most challenging places sometimes, because it is so very individualized and personal sometimes. And there's the risk that it will bleed, you know, heavens forbid this bleeds into and affects my child, right? Like there are some sort of personal relational elements about this that I think it just makes it quite challenging to deal with. And especially, I think so many people, new researchers coming into the commercial determinant space, my sense is that there's probably a degree of naivety about just how bad and dark it could get, and there need to be some safeguards. I'm going to change to Eric and then figure out how to lower my hand.
Yeah, there you go. Okay, great. So going into the stage 5 and 6 here. So one is also developing and implementing rigorous conflicts of interest safeguards. And so what the industry is really good, and this kind of segues into number 6 as well, is the industry is really good about penetrating into all parts of society. And the more we learn about their behavior and understand what they do in terms of their lobbying and marketing, they're able to acquire people who are reasonably, economists or lawyers who believe kind of in capitalism and certain things that are basic business practices. But then they start to enter into, let's say, public health or into areas of human rights that then there's usually a conflict of interest, right? There's something that is maybe unethical of practice that's being done, or maybe something that's not being disclosed in terms of financial, connections with the industry. And so here, and I'll go into deeper of this later when we talk about more conflicts of interest, but understanding that, that if an individual works for an industry, or let's say publishes an article in a paper that gets funding from an industry, right, that there is some conflict there, right? Because these are industries that, have shareholders, and their business model tells them that they need to sell these products and promote these products. And so any kind of regulation or any, kind of attempt to go after them, any way you want to put this, is going to be some kind of issue that comes up. And so being more transparent and looking at some of these issues, which I'll go into later. And then number 6 is really monitoring, exposing corporate activities. So I think this is kind of even one of maybe an earlier step, so that when we're understanding the behavior of these industries and identifying, okay, what is the problem or how these actors are operating. One thing first is to monitor their activity, what they're doing, find patterns, and then expose those corporate activities. A lot of times this is, whether this is naming and shaming, whether this is just, doing FOIA requests to find information, whether this is searching through, industry documents, which again, I'll go into deeper dives later. But understanding and exposing these practices can really tell us a lot about, how we move forward in terms of the public health playbook. And again, one thing you'll hear me say a lot is, I think in public health, we have a tendency to be very reactive of what the industry is doing. So we need to monitor, but by learning from them and exposing their tactics, we can anticipate and then become more proactive in our own public health playbook. So, and again, I'll talk about that later. So sorry, there's so many things to say, but yeah, we can go ahead and move on. So.
All right. I realized I'd forgotten to tell you I'd animated this slide. This is just, I guess, to illustrate the sheer breadth of information. This is one of the master settlements against tobacco. I think this is in Minnesota, but it's not even the main one. This is just one of the other ones. And this is just, can you imagine, before we have big data and just the sheer effort to go through all of this? And the point obviously was to drown the litigators in information. They just never realized it would become an amazing research project. So the last 2 strategies, I guess, are more some of those sort of direct counter strategies pushing back against this. So one of them is around sort of debunking corporate arguments. And so, so I've got lots of Australian examples this morning, but this is an advocacy group called Bugger Up. Billboard, it was against those doctors graffitiing billboards in Australia. And so they have a whole range of sort of different examples, sort of that sometimes called culture jamming. And I know that I think Nick Fortenberg's team in New York does a whole sort of activity and sort of training thing around some of their students around this, which is very fun. Here's one of the modern day examples. We've got Share Coke with obesity. Fun fact about this particular campaign, actually, because I'm full of fun facts about the soft drink industry, because I did a thesis on them. When they first put up with this and they realized, obviously there's a risk, you just enter names in there. Some people are going to enter some other stuff there. So they actually had a sort of board meeting and they strategized all the curse words and possible names that they needed to sort of block around this. So I think it's just kind of funny to think about Coke quasi executives sitting around a table and coming up with really inappropriate names that you have to sort of put into a spreadsheet to say you can't do this. But I think the marketing part is sort of the easier one. You can sort of push back against some of the marketing, but the real core arguments that you have to push back against are the sort of bigger ones that say, like, look, we can be part of the solution, right? We are the UN Global Compact. We are doing all these amazing things. As Eric said, we work with human rights organizations. We work with all of these amazing things. They have been instrumental in distributing the vaccine. Coca-Cola has the longest cold supply chain in the world. They get essential medicines to communities all around the world that you're never going to access because, if we go back to strategy 1, there's no insufficient public sector resourcing to do some of those things, right? It's a vicious circle. So we're part of the solution. Governments are intrusive, and individuals are irresponsible. This to us is sort of the core 3 arguments here that really need to get pushed back against. And the idea that individuals are irresponsible, that's sort of the crux of the social determinants of health, which the commercial determinants and all the determinants sort of obviously intersect with. But it's this idea that, there are circumstances outside our control. I'm doing a fun sort of collaboration with 2 colleagues at the moment, and we're sort of thinking about some of those best buys just don't translate well into other sectors. One of my colleagues works in the housing sector. And so obviously there's some very poor quality and dangerous housing out there that is a huge structural determinant. And can you imagine, the solution is we're going to put warning labels. You shouldn't live in this poor quality tenement housing because it could be bad for your health. Really? Wow, I didn't know that, gosh, I should move somewhere better. So I think sometimes, this is me being slightly sarcastic at 8 in the morning, sorry. I think sometimes it's so easy to have this education and information and awareness raising models. And every time those are developed, a lot of the times the industry will kind of get on board with them. Maybe not so much like the specific warning labels of the disease lung on the tobacco package, but a lot of the information and education that's fundamentally still targeted at the individual. And I think it's incredibly important to sort of move to sort of that upstream thing and talk about, I think one of the amazing things about governments being intrusive and governments being inefficient, there's some really interesting stuff that the Transnational Institute and Public Service International, who sort of work more in that sort of union sort of labor sector, they've been doing lots of work around what's sometimes called remunicipalization, which basically says we've got these services like the postal service or swimming pools or utilities or waste or whatever it is, and it's been private and it's actually really inefficient and it's losing money and it's doing all of this stuff. So we're actually going to take it back into the public sector, and lo and behold, the research shows it's less expensive and it's more effective and it's more equitable and it's better for health. So I think there are some really important examples and empirical evidence to show that governments can actually do a much better job providing some of these services than the private sector. And those are some of the arguments that need to be leveraged here in this space. And the last one that we have before we go into 2 of our deep dives is this idea that the commercial sector is incredibly diverse and different. They do not all want the same thing. Yes, they're very good at building big coalitions and getting behind, that particular argument, putting aside their competition and their commercial differences, something that the public health sector is not so good at sometimes. But divestment, especially in the fossil fuel sector, but we also have, there's a whole range of sort of exclusionary lists. That's an example of the financial sector saying, actually, some of these businesses are too risky for us to be involved with. The insurance sector has seen similar sort of things, especially with climate change coming onto the agenda. There are some areas that are just uninsurable, and that is sort of points to sort of elements where the business sector isn't all going to get on the same page. The picture here with the sort of X's, that's an example of, it used to be the Grocery Manufacturers Association, now it's the consumer food association or consumer something association. It's a peak body, basically, for large food companies in the United States. And they had a lot of sort of, there were policies coming up around genetically modified organisms, around added sugar labeling, and the association had taken a very strong oppositional stance. And then several huge leading companies, which are the X's there, Unilever, Nestle, Campbell's, etc., said, well, hold on, this doesn't align with our values anymore. Now, people in the food sector may be a bit cynical about whether or not the food industry is necessarily, truly on board with all of these things. But the fact of the matter is they perceived this association to be backwards, to be sort of working against them. We've seen similar things in Australia with large trade associations taking very oppositional stances to the Paris climate deal and to climate change. And then, powerful fossil fuel and oil and mining companies leaving those because it was sort of perceived as sort of, bad PR, essentially. So I think there's some really interesting opportunities to identify some of those particular issues that push business associations and coalitions apart, because coalitions are a source of power. So then that's an opportunity to sort of take it back. So let's see. This is, I guess, our sort of, we got this amazing reviews I told you about at the beginning that said, this isn't enough. We want more. We need more rigor. We want more case studies. We said, yes, yes, yes. Do you know of any grants and funding? We would love to do this, sure. But this is essentially some of the next steps that we had thought about. And Eric, feel free to sort of jump in here as well. But this is a huge, big picture thing, right? Obviously, there's going to be regional differences around this. So regional case studies would be one. Focusing on particular industry sectors or actors and doing some of those case studies. If we're really interested in that sort of corporate playbook, we have those sort of 8 quick and dirty strategies. You could pick one and sort of see and sort of workshop how you might actually respond to just one of those. Trying to sort of map out best practice internationally. In my head, the World Cancer Research Fund has done a whole bunch of really interesting case studies around implementing taxes on sugary drinks and interviews on the ground with people in terms of what were the successes, what were the failures. So something perhaps along those lines that sort of says, this is how it's actually worked out in practice. Here are some of the opportunities and challenges, and then just sort of testing. Sorry, I think we have our deep dives now. There it goes. Yes. Do you want to animate it?
Yeah, so I have, so these are going to have like some small animations. So I may say next to do that.
Okay.
So basically, we wanted to go a couple more deep dives into some of these different parts of the playbook. So we wanted to talk about one of these ones, which is monitoring and exposing industry tactics. And then the other one was conflicts of interest. And so for everybody here on the call that is familiar with commercial determinants that are not, so Norma, thank you for your comment about clinicians and other physicians that are really interested in understanding this. I usually try to present this in my public health classes because usually medical students are familiar with the epidemiological triangle. And for those of you who are not familiar with this, this is this triangle right here, where we have kind of the host, the agent, and the environment. And so if we have a scenario where we talk a lot of times with infectious diseases, so you can go ahead and hit next a couple more times, whether this is malaria, tuberculosis, even COVID, there tends to be a host, an agent, and an environment. And for us, for epidemiological purposes and for other medical purposes, right, we want to study the vector of disease. We want to understand how did the disease start, how did it spread, and so forth and so forth. And so this is used in a lot of biomedical approaches and other epidemiological approaches to understanding the disease, especially infectious and communicable disease. So if you can go to the next slide. So I want you to think about that same framing, and you can go one more, when we talk about the commercial determinants of health. So you can use the same formula where you have, let's say the host, which is an individual who is, maybe you have the smoker, you have the agent, which is the Marlboro cigarettes. You live in an environment where there's a lot of advertising, promotion, and sponsorship. But in this case, the vector of disease is not an insect or an animal that is there to spread it, but it's a transnational corporation, a big, large industry like Altria here. And so I think for our purposes, one of the first steps we should think about when we conceptualize and we try to approach this is to understand that if we're going to stop a lot of the non-communicable diseases, things that we can actually modify our risk behavior, whether this is tobacco consumption or alcohol or unhealthy food intake, right? We should understand the focus of these corporations or these big industries. So studying that is going to be the key focus. Okay, so let's go to the next slide. And so if we take that approach, one of the biggest discoveries that happened in the 20th century was the revealing of former industry documents that first started in tobacco. So back in the 1990s, the tobacco industry was caught for racketeering. They had lied to the American public and essentially the world about the addictive nature of nicotine. And there were whistleblowers that worked for the companies that basically shared these documents with some of my former mentors at UCSF and some of those boxes that Jen showed earlier. And then through courts and litigation, the Master Settlement Agreement and others after that, a lot of these documents became publicly available to researchers like us to understand the inside operations of these industry groups. So these documents go all the way back to the early 1900s from all the major tobacco companies. So these are internal memos, correspondence, emails, their planning, their strategy. And basically it gives you an inside look into what the industry is doing. So a lot of times when people speculate or try to understand industry, this gets you behind the veil and you can actually read word for word what the industry is practicing. So this started with just a box of documents, and now there are over 80 million pages in the UCSF Industry Documents Archive Library. So if you have not visited this, I really encourage you to go look that. And again, this started with tobacco, and then Jen, if you can hit the next two buttons forward. But now at UCSF, we have collections, not just based on, or if you can go back one more, sorry, not just based on tobacco industry documents, but now there's been court cases related to opioids, the chemical industry, drug, food, fossil fuel, and these collections are starting to grow. And so this is mostly through court litigation. Documents become available. They are then archived and sent to a team of researchers at UCSF where they index these documents. And then now researchers like us can continue to research around the behavior, the interactions between these industry groups. And so again, if we're studying the vector of disease and we assume that this is the corporation, what better way than to learn from themselves in their internal planning? And then again, I highlighted the bibliography there because there are now over 1,000 published peer-reviewed journal articles that detail, this is for tobacco, and now there's been more, that have used these industry documents. So researchers like myself and others have went internally into these documents, published about them, and then worked with journalists and the media to really expose. So this is just not monitoring, but this is exposing what the industry is doing related to all those practices we mentioned. Yeah, I think that's it. I don't want to go too long. Yeah.
I think to an extent that really intersects well with some of the monitoring work that I've been doing, because a lot of it just comes down to that question of data. So going through those boxes, dear God, right? I'm thinking about how, I've looked, I haven't looked at the industry document library as much, but I do get a sense now that some of them are scanned. Some of them are actually sort of text readable. They're attaching metadata to some of this. You can start to search for some of those bits and pieces. But so help me, what a labor of love and how complicated that is to do. And so what the research that I'm looking at is often looking at, so I look at corporate political practices. So I look much more sort of narrowly, I think, at that sector of lobbying and political donations, not so much in the marketing space. And I'm especially interested in the information that governments provide, and that governments in many cases around the world are regulated and required to provide. It doesn't matter about which industry sector it is per se, it could be Facebook, it could be Amazon, it could be BP, it could be whomever, but we're supposed to disclose some information about that. The Australian case is not very good, sorry. So what one of the things that's one of the more common sort of forms of disclosure is a thing called a lobbyist register. These differ all around the world. Canada and Ireland probably have some of the better examples of good quality ones, but there's still lots of loopholes within them. And essentially what you should get is, you know, a register of all of the organizations that are lobbying, whether this is Coca-Cola and their sort of government relations person and how they're lobbying with, whether it's a third-party specific lobby firm that's been hired to lobby on behalf of lots of clients. You'd have a list of all the meetings that they'd had, whether that's in person, whether that's email, whether that's all of that. You'd get a record of sort of who they met with. So what was the public servant? Was it a minister? Was it elected? Is it just part of one of the agencies? And then you'd also get a talk, you know, when was this? What was the time? Who else was there? And the subject matter, what was talked about? And in particular, and most important, and this is what's missing in most registers, what was the objective of that meeting? What was the purpose? Was there a bill they were trying to push for? Was there, you know, what was the desired outcome of that meeting? And that is probably where most registers fall down. In Australia, what you get is the third parties. So you only get the sort of lobby firms that have been hired to lobby on behalf of someone else, which is probably about 20%, according to some estimates about what all the lobbying is. So we have no idea if Coca-Cola or Rio Tinto has hired a lobbyist and it's gone there. That's not part of the public record. You get some of the lobbyists' background. So one of the things that's also important is whether or not the lobbyist has sort of formally worked in government, sometimes called the revolving door. Only 4 states provide that information. It's very patchy. And then there's just a long list of everything that's missing there. So my project has been trying to link all of those bits and pieces together into a sort of beautiful, useful, interoperable database, which is infinitely more challenging than I thought it was going to be at the start. I knew it was going to be hard. I didn't realize just how impossibly hard it was going to be. On the right-hand side, it was just sort of an illustrative example about one of those challenges. So in Australia, we've got sort of 2 major political parties. There's the coalition made of the Liberal and the Nationals, and we've got the Labour Party. The Liberal Party is the more conservative one in the US speak. New South Wales is one of the states in Australia. All of these terms here refer to the Liberal Party of New South Wales. There's actually more than 100 different ways that this was spelled in the database. And why? Why don't we just have good data entry into? There's just so much inconsistency and incompleteness and messiness through all of this. So I've been spending several months trying to clean and organize it, but I guess this is some of the stuff that you can start to show when you do that. And so one of the things that's interesting, so this is on the left, all the sort of third-party lobby firms, and we just have a count of how many lobbyists they have and how many clients they have. I'll tell you now, the client number is a slight overestimation because I haven't cleaned 5,000 clients yet, but the lobbyists I'm pretty confident on. And it's just interesting. So the ones that have the most clients don't necessarily have the largest number of lobby firms or lobbyists employed. There's no sort of consistent class of, correlation across this. And it even becomes more stark when you look at some and you've got like 19 lobbyists and 1 client. Like, it's really interesting. And it also shows in Australia, for the most part, it's largely a cottage industry. So there's lots and lots where it's just that 1-1 diet. You've got 1 lobbyist, you've got 1 client, and it's just sort of this discrete thing. You have a much smaller sector that are the sort of huge, big sort of commercial lobby firms. And I guess in some ways, that's a sort of perfect analogy for like every other sector of business, right? The food industry is mostly very, very small actors, and there's a couple of huge players at the top of the game. So I guess sort of saying the lobby industry is actually kind of like most other sectors. The other thing that we were looking at was just the breakdown of those industry sectors. Now, in the register, you're not required to disclose what sector you're part of. So this is some of the other stuff we've been trying to add into it. But it's interesting because lobby firms often do pro bono work. And so they'll do pro bono work for health organizations. And so the same lobby firm that does pro bono work for health organizations also lobbies on behalf of harmful industries like gambling or alcohol or ultra processed foods. And so it's really interesting, and it kind of raises some questions around potential conflicts of interest. What's the sort of duty of confidentiality around this? If I'm doing stuff ostensibly for a health sector, but then I turn around and you have no idea in the Australian data which lobbyist is working for whom, what money is potentially flowing, there's just no information about any of that. But it just kind of raises the question, do I really want to have the same lobby firm? So there's so much interesting stuff. And I guess for me, I just would like much, much, much better transparency. I won't go into a huge amount of next step. This is a project I had some students do last year. They worked in data science space. So I think there's just some really interesting potentials to sort of start linking this and start trying to play around and find some of those patterns. We'll go back to you, Eric. And then we can.
I look at the time, so I'll go through these quickly. Sorry, we are kind of running through this. You can see we have a lot to say, but so yeah, just a little bit deeper dive in conflicts of interest and picking up on Jen's point that I think a lot of the things is the lack of data, like what we don't know. So as much as even the internal documents can tell us certain things, it's very hard to distinguish, what are conflicts of interest. And so you can go through these, you can push the next button, because so the idea that Jen was mentioning, this idea of a revolving door, where you do have individuals that have worked in public sectors, worked for the government, but then work in private practice. And you can go to the next one. And we have plenty of these factors. So just one in particular, John Boehner, who was the former Speaker of the House here in the United States, pretty much, third in the line right next to the president, in terms of power and authority, right when he left office, became a consultant lobbyist for R.J. Reynolds, which is one of the, big tobacco companies in the world, especially here in the United States. And so the question then becomes, how can you have somebody who works in, industry, but then also works in government? So you're regulating yourself, right? Which is what the industry wants. They want more of that self-regulation. So conflicts of interest is all about, establishing, certain standard of principles. How do you monitor? How do you have more transparency about, what your disclosures are? So are these financial disclosures, non-financial? Have you worked with an industry group? Have you not? Sometimes individuals are not aware that they have a conflicts of interest. And even if you look at some of the investments, sometimes we're investing into stocks that are, some of these unhealthy commodities. So it's a big entanglement in terms of what Jen's mentioned is kind of, untangling that, right? And finding some of these patterns. And so we see conflicts of interest, in whether it's in government bodies, but we also see them in certain national, international organizations. I think in terms of academia, we see this a lot, where if a study's published, where's the funding come from? So if there's a study that says, that, there's not as much sugar in a certain food, or there's, best practices for physical education or activity, is that funded by, a fossil fuel industry group or a pharmaceutical industry, so there could be some conflicts there. And then we have all kinds of tools for trying to monitor this. I think the most notable one is in tobacco, the Framework Convention on Tobacco Control, which is the first and only international public health treaty, provides, certain sets of recommendations on how to control the supply and demand of tobacco. And one of those is this Article 5.3, which specifically calls out the tobacco industry and says that they are an important stakeholder that should not be invited to have a seat at the table. And so kind of excluding them from the practice because of all of their behavior. And so there are different policies put into place that try to adhere to this best practices by not allowing the industry to necessarily participate and so forth. Okay, just go to the next slide and then we can finish here. So some of the work that I do looks at these conflicts of interest in many different ways. Just one notorious example, if you haven't noticed it here in the nutrition world, is that in the United States, we have dietary guidelines, and there's a committee that makes up these guidelines, and they're comprised of 20 experts in nutrition. And so there's questions of, how do they come up with these 20 individuals, right? How are they selected? Why do they make the decisions that they make? And I just think, from a public health perspective, if we focus on, let's say dietary recommendations, we should at least understand a little bit more about who's making these recommendations and where they're coming from, right? And so we did this study where we looked at all of their disclosures, we looked at their publications, to their CVs, to their funded grants, and we found that 19 of the 20 members have some kind of connection with the food or pharmaceutical industry. And so that tells you that, that not only have these corporations have penetrated what we talked about, the revolving door, but it's also what we call regulatory capture, where this agency that is providing guidelines to all of us, Americans here around what to eat or not to eat, is really based on some kind of industry influence, whether that's the narrative or the focus. And again, it can go very deep, but we did publish a paper on this, you know, if anyone's interested in, but it speaks to the level, the depth of what we're trying to tackle here. So I think, Jen, you have questions. Now we can open it up with our final 10 minutes. See, there's so much to go through. Yeah.
And that's all from us. We'll hand back to you, Rima. These are just some of our thoughts.
Thank you so much. This is a very rich, and it's been a really interesting presentation. Thanks, Dr. Crosbie and Dr. Lacy-Nichols. You took me back 20 years to the documents. I was one of the ones that physically looked at them, if I can, I'm aging myself right now, but yes, and used them to advocate against industry interference locally and regionally. So thank you. And one thing that I also thought about, Jenny, when you're talking about criticizing lobbyist registers in Australia, thinking about challenges in other countries where also those registers do not exist and may not ever exist. How do you do this kind of research in context where this data is not available, and how can you advance the field? So I'm going to leave it to see if there are any questions that anyone would like to have for our speakers. We have a few minutes left, so it will allow us to sort of take a little bit of questions, have discussions around certain topics, some of the points that were raised as part of the playbook. I'm looking through the list. If you want to raise your hand or unmute yourself, you're able to do that to ask a question. I don't see anyone. I want to pose a question just until somebody comes up with one. I remembered when I think Eric, you were talking about the second point in the playbook with regards to, you call it public health training and coalition building, and talking about this group of people that need to be engaged. And I was wondering what your thoughts are about, should it be a public health training and coalition, or should it be more multi-sectorial or multidisciplinary training and coalition, knowing and basically based on all what you've said so far, and even from yourselves for the disciplines that you come from also, how, I mean, it might be a little more challenging, but it seems that a lot of the issues would require, in order to break down the silos, even within the field, how can we connect, if we can build this knowledge and tools, build people's tools that are from other disciplines, not only from public health, so that they can see this, see the issue in terms of commercial determinants of health.
Yeah. Okay. Well, I'll just take a quick crack because I know we're at time, but I do think it's multi-sectoral. I think we can not only train from a public health standpoint, but because public health is the revolving issue around most of these issues, in public health, we talk about like health in all policies. So how do we communicate the importance of health in these other areas? But yes, people in public health need to understand the importance of economics and finance and these other business practices as well. One of the things that I noticed when I did some of my early work in tobacco, especially in Australia, talking to trade representatives, because that was a big barrier towards plain packaging and some other policies in Australia, was this idea of understanding norms and dialogue with different disciplines. So there were some cases where some public health sectors felt, well, this is health, this is important. And they would find a lot of problems. But there were others that said, okay, let's try to talk to these trade individuals in their language about the importance and norms of health, but also make them realize that this also has an economic and trade impact. And so they would talk about, what does it mean when people smoke more, and how does that hurt the workforce? What does this mean in terms of development? And so you're still communicating the importance of health and the harms that you're worried about, but you're doing it in a language that they understand and they're invested as well. And so you make it not a zero sum, but a positive sum where, all parties are interested in amplifying it. And I could go more examples, but Jen, I don't know if you want to add anything to that. So, yeah. Okay.
Thank you. I don't see any hands raised. There's a question with regards to availability of slides. I want to inform everyone that the the webinar itself will be posted on the network's website. So you have access to the recorded webinar. With regards to slides, I will follow up definitely with the presenters. If that is possible, we will definitely make them available and let you know through email.
I think Norma has a question.
Oh, Norma, yes, I don't see that. Please go ahead,
Yeah,
Norma.
how we can push back against public-private partnerships in WHR. It's funny, I was actually reading a paper about conflicts of interest in the UN sector from like 10 years ago, but it's from the Stanford Law Review. So this is the lawyer's perspective on this. And they're saying, so it's really interesting. If you go back to the origin, you've got the League of Nations and all of that. And you were always supposed to have engagement. You had the International Chamber of Commerce. Sorry, this paper is just like so lodged in the top of my head right now. But we've always had coalitions coming in. We've always had that participation, and it was always seen as good and legitimate. And one of the questions then is, so businesses were excluded. Businesses were excluded, but you could have sort of associations, and you could have organizations with the idea that most of them are probably going to be sort of advocating for their members and advocating for other bits. But we all know that business associations, we have the concept of astroturfing and front groups. I think the term that they coined in the paper was astroturf activism. But I think there's two parts here. One is that going back to the sort of theme of data and transparency across all of this, we simply don't know a lot of the times who any of those members are. Ireland, I believe, has recently closed one of the loopholes in their register, but only for half of their register around that. And so there's some sort of whole, I'm not going to get all the technical details right, but essentially if you've got employees that aren't paid or something like this as part of your association, then you now have to disclose who all of the members are. But there should just be a blanket thing. If you are an association-based organization and you have members, it should be public who all of your members are and what the funds are and all of that flowing into it, because we just need to have some of that. In terms of the public-private partnership with the WHR, I think that, and this is, I'm going to say this in like 1 minute, I think it comes back to some of those questions about conflicts of interest, because Bill and Melinda Gates Foundation, they are a corporate funded foundation, just like Zuckerberg Foundation and the Chan Foundation, and all of the other sort of, I am a wealthy business owner and now I'm going to have a foundation. And we all know that you don't pay taxes if you're not for profit for the most part. So yes, you might do lots of legitimate work, but you also might be evading your taxes at the same time. So do we want, we want to have participation. Participatory governance is good. It's the foundation of democracy. And I do think there's a legitimate place for some businesses to be involved with this. In Australia, we have fantastic Indigenous owned Black businesses, and we have small businesses, and you have female entrepreneurs, and there's all this amazing work internationally about entrepreneurship and building the businesses. So I think it's unlikely we're going to get rid of commerce, full stop. That seems a bridge too far. But where,
after you're done, when you're done, yeah, sorry.
Where do we draw the line? Where do we, I think we're not there yet. I think we can paint the tobacco industry and alcohol and some other sectors very easily. And I think it's much trickier once we go to other bits. Eric.
Yeah, just real quick, I know we got to go. So we're doing some work in Mexico right now on public-private partnerships. We're dealing with drinking water and also like sanitation and food. And these are partnerships with Coca-Cola, Nestle. So again, we're not talking about normal businesses. We're talking about the businesses that we have on our radar. So similar like tobacco. And what we're finding is that, one, there's a lack of data, so we don't know as much. But what we're finding from these practices is that a lot of like the literature on public-private partnership says, yes, they do X, Y, and Z, good, but there's no one who's monitoring and tracking this. And so we are monitoring and tracking it. And they say a lot of these lofty goals like they do in their corporate social responsibility. But when actually you measure the actual activity of what they're doing is, yeah, they're providing a little bit of help, but at what cost? And so I think exposing those practices and showing this is what this industry is doing, I think is at least a start to having that, because what the food industry is doing, we know from the documents, they are not taking the tobacco approach. They're taking what is called an appeasement approach. They don't want to, and Jen, you've written about this, they don't want to have that adversarial, controversial role because it's going to hurt their profits. So how do you deal with that delicate balance? Yeah, so sorry. Oh, Rima,
Thank
you're
you.
muted.
Thank
Yeah,
you. We
okay.
have a comment from Sabah saying in developing countries, we haven't finished with the tobacco industry. And so we're sort of jumping forward and trying to promote, and this is part of the mission of the network, and the objectives is to spread, raise awareness among professionals and public health professionals, practitioners about the commercial determinants of health. Learning more about tobacco industry practices in the developing countries can maybe help us jumpstart facing other industries like the food industry, or starting working on the alcohol industry. So there's a lot still to do. And your comment about governments defending corporations, part of this work also is informing about commercial determinants and raising awareness about commercial determinants so that governments understand, as Eric just said, that at what cost is this this involvement. I want to thank you for this webinar. It's been excellent. Thanks everybody for participating, and we look forward to our next webinar, which will be advertising soon, bringing forward many of those topics also and expanding on them. Thank you for all the work, Eric and Jen, that you're doing in this field, and thanks everyone for joining.
Yeah.
Thanks for having us.
Thank you, everybody.
Have a good day, Rima and Eric and everyone.
Bye.
Bye.
Thank you.